Let me ask you something most men think about but rarely discuss openly. What actually happens to your body if you ejaculate every single day? Is it good for you? Could it harm you? Might it improve your performance or quietly drain your vitality over time? If you've wondered about this, you're definitely not alone. I hear variations of this question constantly in my practice from men in their 30s, 50s, even 70s. It's one of those subjects that stays buried under myths, half-truths, and sometimes even guilt. Yet it's deeply connected to your health, your relationships, and your confidence. Today, we're bringing this conversation into the light. I'm Dr. Jocelyn, a board-certified urologist with 5 years of experience helping men understand their bodies and take control of their health. In this video, I'm going to walk you through 5 surprising benefits of daily release, 5 important considerations you should be aware of, and most importantly, how to figure out what's actually right for your body and your life. By the end, you'll have clarity. No shame, no confusion, just honest, practical answers. But first, do me a favor, drop a comment and let me know where you're watching from today. I love seeing how far this community reaches. And while you're down there, hit that like button and subscribe, because every week we tackle the men's health topics most people avoid. All right, let's dive in. Here's the first thing you need to know. There is no one-size-fits-all answer. Ejaculating every day isn't automatically healthy, and it isn't automatically harmful. It depends entirely on why you're doing it, how it's affecting you, and what's happening in your body and mind as a result. Some men feel fantastic with daily release, better sleep, less stress, more energy. Others notice it leaves them feeling drained, distracted, or less interested in intimacy with their partner. So the real answer? It's personal. It's about your biology, your habits, and where you are in life right now. And listen, if you felt uncertain about this, that's completely understandable. Most men were never taught how their bodies work in this area. That's exactly why I'm here. After 5 years as a urologist, I've made it my mission to turn complex medical science into simple, usable information. Think of this as a conversation between a doctor and a friend. My goal is to help you understand what's happening inside your body so you can make informed decisions, not live by fear or outdated myths. So let's break it down. First, the 5 surprising benefits. Then, the 5 things you should watch out for. Benefit number 1, hormones that reset your mood. Ever notice how calm and relaxed you feel afterward? That's not just in your head. When you ejaculate, your brain releases a powerful blend of chemicals. Endorphins, which ease tension and pain. Dopamine, which drives motivation and reward. Oxytocin, which builds connection and trust. And serotonin, which stabilizes your mood. Biologically, this cocktail resets your nervous system. Emotionally, it can soften anxiety, lift your spirits, and help you feel more grounded. Practically, that means less irritability, less tension, and more day-to-day resilience. It's like a natural reset button, not a cure-all, but a gentle, consistent form of self-care. Benefit number 2, better sleep. Have you ever felt that deep, heavy relaxation after orgasm? There's a reason for that. Your body releases prolactin, a hormone that promotes drowsiness and relaxation. Combined with all those calming endorphins and oxytocin, you've essentially created a natural sleep aid. For men who struggle with racing thoughts, stress, or restless nights, this can mean falling asleep faster and staying asleep longer. Biologically, it's about hormones doing their job. Emotionally, it's relief from tossing and turning. Practically, it means better recovery, sharper focus, and more energy the next day. Benefit number 3, improved circulation. Orgasm isn't just a mental experience, it's a full body event. During arousal, your blood vessels open up, your heart rate increases, and circulation surges throughout your body. This process, called vasodilation, helps deliver oxygen and nutrients to your muscles, brain, and skin. Biologically, it's like a mini cardiovascular workout. Emotionally, it can boost confidence by improving the quality of your erections. Practically, it keeps your vascular system responsive and healthy, an often overlooked piece of long-term wellness. Benefit number 4, potential prostate protection. This one might surprise you. A large-scale Harvard study followed over 30,000 men for nearly 2 decades. The findings? Men who ejaculated 21 times or more per month showed a lower risk of prostate issues over time. The theory is that regular ejaculation helps flush out the prostate, clearing away old cells, inflammatory agents, and other buildup that could otherwise contribute to problems down the road. Biologically, it's a natural cleansing process. Emotionally, it offers reassurance about one of men's biggest health concerns. Practically, it suggests that sexual activity may play a role in long-term prostate health, though of course, it's not a replacement for regular checkups with your doctor. Benefit number 5, immune system support. Here's a bonus you probably didn't expect. Research shows that sexual arousal and orgasm can increase levels of IgA, immunoglobulin A, one of your body's first-line defenses against viruses and bacteria. Combine that with lower stress levels, which naturally strengthen immunity, and you get a subtle but real boost to your body's defenses. Biologically, that's a stronger shield. Emotionally, that's peace of mind. Practically, it's another reason sexual health fits into overall wellness. Now, let's be honest. Daily ejaculation isn't without its considerations. For some men, it can actually backfire. Here are 5 things to watch for. Consideration number 1. Is it a choice or a compulsion? There's a big difference between a healthy habit and something you feel controlled by. If you're choosing daily release consciously for pleasure, stress relief, or intimacy, that's one thing. But if you feel driven by the urge, if it starts pulling you away from work, relationships, or focus, then it's worth pausing and asking yourself, am I in control here, or is this controlling me? Biologically, compulsive patterns can rewire your brain's reward system. Emotionally, they create guilt and shame. Practically, they drain time, energy, and even connection with your partner. The key question, am I choosing this or is it choosing me? Consideration number 2, are you using it as an emotional escape? We all face stress, boredom, loneliness, or sadness. That's human. But if ejaculation becomes your only tool for coping, it might be masking deeper emotional needs that deserve attention. Biologically, it creates a dependence on one pathway for relief. Emotionally, it can prevent real healing. Practically, it keeps you from building healthier outlets, like exercise, journaling, meaningful connection, or even therapy. Sexual release should be one tool in your toolkit, not the only one. Consideration number 3, trying to conceive. If you're not trying to have kids, this doesn't apply. But if you are, daily ejaculation can lower sperm concentration. Biologically, sperm need time to replenish, usually 48 to 72 hours. Emotionally, this can add stress for couples working toward pregnancy. Practically, spacing things out every 2 to 3 days during conception efforts may improve your chances. It's not about abstinence, it's about strategy. Consideration number 4, reduced sensitivity over time. Paradoxically, too much of a good thing can dull your reward system. Daily ejaculation, especially when it's rushed or repetitive, can lower sensitivity or reduce spontaneous desire over time. Biologically, your brain adapts, and dopamine's impact weakens. Emotionally, it can create a flat, unmotivated feeling. Practically, you might notice less arousal or interest in intimacy with your partner. The good news? Short breaks, even just a few days, can reset sensitivity and restore that spark. Consideration number 5, rushed patterns and performance. If daily ejaculation happens through quick, hurried stimulation, your body can learn to expect speed. Over time, this can train your nervous system for premature responses or create performance anxiety with a partner. Biologically, your body adapts to sprint mode. Emotionally, it creates frustration for both you and your partner. Practically, it undermines confidence in the bedroom. The fix? Slow down. Practice control. Train your body for rhythm, not just release. Daily ejaculation isn't inherently good or bad. The key is understanding why you're doing it and how it's affecting you. Ask yourself, why am I doing this? Stress relief, pleasure, intimacy, or compulsion? How is it affecting me? Am I sleeping better and feeling confident? Or noticing fatigue, guilt, or flatness? Does it fit my goals? If I'm trying to conceive, do I need to adjust? Here are a few practical tips. Pay attention to your body. Track your energy, mood, and desire. Experiment. Try daily for a while, then try spacing things out. See what feels best. Balance. Make sexual release one part of a larger wellness routine. Communicate with your partner if you have one. Never ignore changes in erection quality, discomfort, or other symptoms. Those deserve a conversation with your doctor. If you felt shame, confusion, or even fear around this topic, I want you to know You're not alone. Sexual health is part of human health. Asking these questions doesn't make you weak, weird, or broken. It makes you wise. Because the more you understand your body, the more freedom and dignity you gain in your daily life. Here's the truth. Ejaculating every day can be perfectly healthy, or it can signal habits that need a little balance. It's not about rules, it's about self-awareness. And here's the most empowering part. You have the power to adjust. Small changes, whether it's adding a break, slowing down, or using intimacy as connection instead of escape, can give you more energy, confidence, and control. Age is not the end of vitality. Whether you're 30, 50, or 70, your body can adapt, your health can improve, and your confidence can grow. So keep learning, keep listening to your body, and keep building the kind of life that gives you comfort, freedom, and strength. I'm Dr. Jocelyn. Thank you for spending this time with me. If you found this video helpful, give it a like, subscribe for more honest men's health content every week, and share your thoughts in the comments. I read them all, and this community means everything to me. Remember, your body is worth understanding, your health is worth protecting, and your vitality is worth fighting for. Take care of yourself. You deserve it.